Today we're going to talk about healthcare and the next boom, because we're going to see absolutely incredible growth in global demand for healthcare, which could easily double over the next 10 years from around $6 trillion today to perhaps more than $12 trillion over the near future 10 years from now. I say that because of the incredible growth in the household incomes of the middle class in the emerging world. And those households are going to demand much better health care, which is going to be much more expensive. And secondly, because in many nations around the world, including the United States, China, and much of Europe, there's a rapidly expanding senior citizen population, which is going to mean much more demand for health care. Let's start by looking how health care money is spent around the world. As you can see in this slide, health care in the United States is an absolutely incredible expense at about 17% of GDP. Spending an average today of about $8,600 per capita, an astonishing amount which probably is unsustainable for the long term. But meanwhile, there is just immense healthcare spending here. Now look in the middle of the slide at the basket called the OECD nations, which is 30 of the world's most mature economies. Places like Japan, the UK, Germany, Korea, Canada, and the United States, by the way, is in that basket, where current healthcare spending is only about $3,000 per capita. A lot of difference between there and the United States, but let's look outside of the OECD developed nations at the rest of the world, where healthcare spending is running only about $88 per capita, which means that most people around the world just really aren't getting any healthcare at all. In fact, healthcare is one of the single biggest business opportunities in the history of the world, as more and more demand for better healthcare spreads around the world. An incredible opportunity for companies both in mature economies like the United States, Japan, and the EU, and for companies that deliver healthcare in emerging markets. China, for example, despite its incredible economic growth, is spending only about $19 per capita on healthcare today. That's right, only about $19. Now, the government in China has a very ambitious plan to make healthcare available throughout the entire nation by about 2020, which means that healthcare spending will approximately grow eightfold over that period of time on a per capita basis. It will still be a very nominal amount. It also means that China faces the challenge of delivering healthcare to about 1 billion more people over the short term, an incredible challenge. Now, having not a lot of money to spend on healthcare per capita in the emerging worlds means that there will have to be a lot of innovation. In other words, companies in China, India, and elsewhere are going to be working very hard on delivering quality care at very nominal cost. And a lot of their discoveries and new ideas are going to spill back towards the United States and Europe in reverse innovation. In other words, innovation determined in the emerging world that can cut costs is going to come back to places that desperately need to cut costs, like the United States. A great example is one of the most famous medical entrepreneurs in the world today, a Dr. Shetty in India, who studied at one of London's finest schools of medicine and returned to India to pursue his healthcare career. He first became famous there for saving Mother Teresa by doing heart surgery on her. And he has developed a series of incredibly successful heart surgery hospitals around India with tremendous outcomes where open heart surgery can be done for about $2,000 per patient, vastly less than it costs in the developed world, and again with fantastic outcomes. Meanwhile, we're going to see tremendous convergence of our three biggest technologies for the next boom: nanotechnology, biotechnology, and advanced wireless services. We're going to see tremendous convergence of those technologies into delivering better, more cost-effective, more efficient healthcare. Nanotechnology, for instance, is already converging with biotech, where nanotech is able to deliver advanced bioengineered drugs directly to the molecules that need them in a patient's body. It's going to absolutely, eventually, revolutionize pharmaceuticals and the way they are delivered. Biotechnology is about to really come into its own in healthcare as we are slowly but surely getting into that era of personalized medicine we've been watching for so long, where physicians will understand an individual patient's genetic makeup and understand what drugs will best treat that patient, what drugs will have the most positive outcome, how to avoid drugs that would have a negative outcome. Watch for incredible advances in the total global healthcare market and the amount of innovation that comes back to mature economies from the emerging world, and the application of technologies really boosting the way healthcare is delivered. Thanks, I'm Jack Plunkett. Come back soon for Chapter 9 of The Next Boom.